since it seems to be right in the thick of what we do. There's so many ways to come at this question. This comes up over and over, and I really hate that. I understand why we end up calling it quality versus access, but I would maybe beg us to try not to do that, because I don't think there is any way to move forward to inextricably intertwine, it's a lot of eyes, without thinking about both. They have to move forward together in a balanced approach. I don't think we'll be successful in a quality rating improvement and access system. That's going to take some getting used to if we don't. So I think that this question comes at it, well, probably three different ways. One, I think, is that we are thinking about access in terms of, at least I think about, if we're going to move forward with the statewide system, where do we take that? Do we do it in a way that allows access, frankly, to the programs also to be able to be rated at a pace that allows us to have enough programs so that parents can continue to make the kinds of choices that we believe parents ought to have? So that's an access issue of the sort of 50,000-foot level. Access to get rated, access to programs or to parents to the various settings, and doing that in a way that makes sense from a pace. And that there's a lot of pressure to move quickly, and yet we want to be cognizant of the work that needs to be done in the infrastructure. I think, though, what's hidden under this question often is the question of money. Big surprise. And I say this at the risk of doing exactly what I just said, which is not to pit one against another, but I think contextually not everybody always knows the way that those dollars currently look. And so, and I'll ask Cheri to correct my math, which I'm sure she will if I get it wrong. But the vast majority of funding, of any kind of funding we really have in this state for anything related to early child care at least, is the child care assistance funding, the CCDF funding that comes from the federal government. Yeah. Only 4% of that, by federal law, is required to be spent on all the activities that are considered the quality set aside. So that includes the consumer portion, helping parents actually find care. So I've got my subsidy. I'm lucky enough to be one of those people that got CCAP. Now what do I do? And if I want to have informed information, I want to have help in finding out where those programs are, that has to come out of that. All of the training, the grants, the professional development, coaching, supports, all those things we consider quality building activities comes out of that small pot. When you think about what it covers, to say that it's a small pot. So something in the neighborhood, I think, of 10 million this year is going into quality, and 215 million is what's the actual direct support. And I'm not, again, saying this to do us versus them. I just think it's important that when people get concerned about that, spend more on quality than on access, we have a long way to go before we'd ever be in that boat, I guess is what I'm trying to say. And that with a small amount of money on the quality side, we're able to do quite a lot. And I say this as somebody who sits right in the middle of both those audiences. When I was sharing with somebody before we started, I've recently asked to have all of the, we run a website that Nancy Johnson is here, and she started it long ago called, it was at GMDCA in the old days, called Child Care Financial Aid. And now it's on our website, and we are looking at improving it, changing it. And so I've asked to have all of the survey results come to my inbox. And usually it's a survey that just says, was this helpful? Yes, no. But there's a little place at the end where open-ended remarks can be made. And I tell you, it is heartbreaking. You know, parents are coming on there and basically finding, as no surprise, they probably don't qualify for much, and then saying, isn't there anything else out there? Please help me figure this out. So it is both humbling, heartbreaking, and keeps that parent piece front of mind for me. Conversely, we work directly with child care providers, and we understand the limits of the money that's been available. And as child care assistance has gone down, the market rate is abysmally low, and the kinds of dollars that may have been there once to do improvement on quality aren't there. And so if we don't have dollars coming from other sources, they aren't likely to happen. So I think we have to have both, and I think we need to do it at a pace that makes sense. We need motivation and incentives for providers. A lot of what's coming out from the MELF talking about incentivizing is, I think, good conversation. We also need the readiness and of both the parents and the community. I think we learned a little bit about that in quality with Parent Aware in some communities. And we need that infrastructure capacity, and they all have to move. It's a careful balancing act. I wish I'd spent more time in gymnastics. I didn't, but it's a very careful balancing act.
Well, so here's what comes to my mind as I thought about this question. There is that, you know, we have on one side we have, you know, the QIRS, QR, whatever that is, whatever the letters are in what order they go in. so that we have that on one side of the equation, and that gets at, you know, the quality and increasing families' access to quality care for their children. That gets at it from one side. But the question I continue to think about is, if we have a community that is very impoverished, and we have this diversity of care that is being experienced by children, how do we ensure that whatever door they walk into, they're receiving? That's the access piece that I kind of get stuck on. And children are experiencing many different kinds of care, low-income children. And in many cases, my work right now is primarily around the needs of homeless children. And very young children, what I'm finding is the majority of them are not accessing any type of, they're not in the access discussion at all. And they're suffering the consequences of a system that isn't ensuring that those that have the greatest need are getting what they need. So I get kind of that this idea about access gets very complicated for me, and I don't really have, that's as far as I can get. I come up with a lot of the questions, and I think about it from those kind of different perspectives. But what I will say definitely is that those years that I had the privilege of sitting on the Minneapolis School Board, I heard year after year after year, it was 7 years, and every year I heard similar information about the status of kindergartners, poor children of color as they enter the school district, and how they progress over a year's time. And the data didn't change. We have to, as a state, or as our community, we have to kind of continue to grapple at these things that puzzle me and plague me about access and quality, and it reaching the children that are in the greatest need. Because if we use the experience of kindergartners in urban school districts, we are missing the mark completely.
Mm-hmm.
To start by saying a theme that I've been hearing from people in our region, childcare providers, mentors, coaches. That is a strategy that they embrace. A few weeks ago, I had the opportunity to sit in on a listening session with Childcare Works that was held in Duluth. And those providers talked about the quality issue. And they said, you know, we work 12-hour days, start at 6 in the morning, and the last family picks up their child at 6 in the evening. Quality rating, now, really, when you're alone in your home with these children, are you supposed to take and do paperwork, or are you supposed to be tending the children? So are we eroding quality by saying, yeah, sneak away for a few minutes and do this, because then you'll have a quality rating? They also were very honest. What is the outcome? What does that get me? They said, really, I have a waiting list already. They are regarded as quality, or there are parents who want their care. And so they said this just does not work for us. But on the other hand, what seems to work well is having that mentor or coach who can come to their home, work with them on this, and really give them the kind of support that they need in order to achieve quality rating. It isn't that they are adverse to it. In fact, they really many of them want to learn more and know what they can do to improve the care that they're providing. One strategy that I did hear, and Ann's probably going to be pleased to hear this, and I didn't tell her before and she didn't pay me to say it, but the Building Quality Initiative, the CCR&Rs are, the people are going out and working with child care centers and family centers, and the response has been incredible. People in those places are saying They have fresh eyes. Somebody who's coming in, talking with them about their work, giving them some value and recognition for what they're doing, and then being supportive. Not so much to judge, but be supportive and give them some help in figuring out new ways to improve quality in their settings. The one little addition to that is that it would be helpful if these people all had that early education, early care and education background. There's one other thing that I do want to mention, and that is that the state grants that have been available through CCR&R some years ago, those grants were open to ECFEs applying for them. ECFEs then in turn could be those home visitors, those mentors, those coaches. In my session with Child Care Works, the listening session in Duluth with all these providers, Hermantown Proctor providers, brought up that opportunity and said that meant so much to them and was so helpful to have those ECFE people who reached out to them, and I think it was 26 providers in Hermantown and Proctor. Well, that's really broadening impact. And there really was the feeling that that is a more meaningful use of those grant dollars than individual providers applying for some kind of support in their child care.
So the things that I wanted to focus on about improving quality of childcare and access to quality, the big words I have written down here are target the expansion and build from strengths. We have a rich history of experience here in our state in a lot of different little pots. We need to get those pots together. We need to help people access those pots. So we need to continue to build effective systemic partnerships. I mean, that's a huge piece that we need to do. Ann was talking about, I know she was talking about not versus, but quality or direct services, and saying that the $215 million that's available for the Child Care Assistance Program is kind of the biggest pot of money in the state. Well, then she's forgetting the fact that we have a huge investment in Head Start in our state, with a rich history of experience. And we in the Child Care Assistance Program have been working very hard with our Head Start partners to figure out ways to do cross-program investments so that there are more full-day, full-year slots available for kids in Head Start programs. Those are the areas where there are high concentrations of low-income kids. That's our target audience, and we can be more strategic if we build more systemic partnerships. So that's an important piece of our work. For the most part, those are with licensed family child care providers or with center-based providers at this point in time. I have heard in recent conversations in the CCDF advisory group that there are lots of situations where children come from their family, friend, and neighbor provider situation to Head Start for part of the day. I've also heard in conversations at the regional level with our federal officials that there are restrictions on Head Start providers reaching out to family, friend, and neighbor providers with supports and assistance. Their connection has to be to parents. I mean, that's part of the thing you were bringing up with home visiting. There are some little glitches that if we could just tweak them, we could do more with what we have already. So that's one important part for me. And we already have a lot of quality pieces in place. Another thing is, in the report, you talked a little bit about access to care for children with special needs. Minnesota has a rich experience of work with partnerships across agencies in support of children with special needs and more positive development for them. It's a great entity that's available to all families in Minnesota and supports all families. The Child Care Assistance Program has some families who present with children with special needs. And we can pay higher rates if we need to, and we have in some cases, but it's been a pretty haphazard process for deciding, what goes on. And more often than not, when I was signing those requests, I was seeing people saying, no one else will take my child. I need more money because I can't take as many or my provider needs more money because she can't take as many kids because she's taking care of my child. That's not, doesn't make any sense. It's not good for the kid. It's not good for the provider. I mean, and we have a good system that they should be linked to. So we're now making purposeful efforts to work with the Center for Inclusive Childcare, to work with the Department of Education, to work with the Department of Education's partners, which are us and Health also, and to link these families as effectively as we possibly can to resources that will be available to them long after they're in the child care assistance program if this works for them. So that's another important piece we have to keep thinking about.
Now, would that special need kids lose child care if their parent lost their employment?
Yes. Yes.
Yeah. Okay. So that's the rub.
Yeah. So then you want to talk a little bit about some of the efforts we've made to link to higher quality in different ways through the child care assistance program. Okay. In the last question, let me see, where is it again? How can CCAP reach more children, more low-income children, and how can we balance healthy development of children with the work status of parents? I have two different answers for that. One, how can we reach more children? I want to point out that the MFIP child care program is a forecasted program, and that there are lots more MFIP families than there are MFIP families' children on the child care assistance program. For some reason, we are not necessarily meeting the needs of many of the families most at risk in our state who have children. They're not connecting with us for some reason. We have to dig deeper into that and figure out what it is that we're doing that isn't working for them, and then figure out how to make better connections. That's something that doesn't require funding. I mean, it's a forecasted program. If we could do a better job with the money that we have, we would make progress in reaching more low-income kids. Another thing that we're doing is trying to make the child care assistance program payments and policies more provider-friendly and family-friendly when providers are presenting as high-quality providers. We're doing this in a number of ways. For lots of years, we've done it through the credentialing bonus. The credentialing bonus is available to providers who meet certain accrediting requirements or have certain degrees or training criteria, things like that. The reason there's such a variety of things that could qualify is that this is available for any kind of provider, a center-based provider, a licensed family child care provider, or a legal non-licensed provider. So if you have the qualifications and you tell us about them, we can pay you a higher rate because of that. That's hopefully helping some families have access to providers who would charge more in the private pay market than child care assistance can normally pay for. That's a small piece. We have, on one of these pages, I have about 260 providers statewide currently receive a payment with a differential through this particular entity. I don't know how many kids that's touching at this point in time. The other piece that we've done in recent years, and which is a pilot project and which is due to end in June of 2011, is the School Readiness Connections program. And that's a program that started out prior to the quality rating system work in Minnesota. But it was anticipating the quality rating system work in Minnesota. And we started it out by sending out applications to providers who were already serving at least, let me see, their service population, the number of kids in their program was at least 25% child care assistance program kids. And they declared that they were meeting certain criteria and qualifications that we felt would be represented in the quality rating and improvement system. In a 30-day turnaround period, we got 240 applications. We had money available to support 14 providers. It was open to legal non-licensed provider partnerships with other providers also. We didn't get any legal non-licensed provider partnerships in that first round. We probably would never because of the qualifications that are required. But I mean, it was one thing that we were considering for if they could come up to that, why wouldn't we do it? So there was that piece. That has actually gone really, really well. There are 236 kids that are participating in that program on a monthly basis. The evaluation results are good. The providers are, I think we worked out some administrative glitches, but the result of it is that if a family qualifies for this and has a child from 0 to 5 years of age, that family can get an authorization for full-time care, even if their schedule changes, or if they work less hours. As long as they still qualify for child care assistance, the child can stay. So this is addressing Barb Yates' issues about getting kicked out of your early childhood experience, and we're trying to get that out of the equation with this when we have high-quality providers that we know we're partnering with. The other point I wanted to make
But that's
about...
a pilot that's ending. It's a pilot that's ending, right?
It's a pilot that's ending. And we pay higher rates for them too then. In the second year of the project, we connected some of these, we asked these providers to connect with Parent Aware. So they're all being rated under Parent Aware right now. And we're seeing that some of them aren't they're not coming in at 4s under Parent Aware. Some of them are, not all of them are. But I think an interesting part is that we touched a lot of kids because we met the providers and the parents where they were at, and then we will work with them to bring them to the next level. I mean, I think that's an important piece. Parents believe they're choosing providers that are the best providers for their children. And if that's where the parents' trust and choice is, then let's work with it. Let's move it to the next level.